Hi everyone, my name is Roberta Castro. I'm a Brazilian pediatric intensivist, and in this video, I'll summarize important points regarding delirium management in children. So, how to manage delirium in pediatric patients? I know it's a big challenge, but prevention and treatment of delirium can benefit from an interdisciplinary approach based on identifying delirium and, if possible, correcting clinical conditions that may be contributing to its development. Management of delirium is based on treating its underlying cause. However, modification or correction of the underlying condition is not always possible due to the complexity of the clinical manifestations of critically ill patients. Therefore, attention should be paid to reducing other risk factors, especially modifiable ones, such as the pediatric intensive care unit environment, improving the comfort of the patient. In addition, it's essential to provide psychosocial support to a child with delirium and the family. The use of a non-pharmacological approach to the prevention and treatment of delirium has been well established in adult patients and now is also suggested in children. So, in the recent pandemic guidelines, given low patient risk and possible patient benefit to reduce the instance and or decrease duration of severity of delirium, Smith et al. Suggests the following non-pharmacologic strategies: optimization of sleep hygiene, use of interdisciplinary rounds, family engagement on rounds, and family involvement with direct patient care. This quality of evidence is low. The non-pharmacological approach consists of routine assessment of patient's level of sedation, aiming at goal-based sedation so that the patient remains comfortable but awake, avoiding the use of benzodiazepines. When a iatrogenic is suspected, the team should review the prescription and discontinue medications that are no longer needed, restarting chronic medications as soon as possible, and reducing exposure to medications that can cause delirium. Early mobilization and regularization of the sleep wake cycle should be encouraged by the entire team. The environment should be comfortable with objects familiar to the patient. Visual and or hearing impairments must be corrected with the use of glasses and or hearing aids. Literature also suggests other non-pharmacological interventions such as optimization of sensory stimulation, increasing social interaction in hypoactive delirium, and transferring patients with hyperactive delirium to quieter rooms, encouragement when possible to eat and to drink, attention to the presence of fecaloma and bladder, therapy with animals, and the ICU diaries. So, through the HUF bundle, Society of Critical Care Medicine seeks to train the interdisciplinary team to provide care that can improve patient outcomes after leaving the ICU. So, letter A, assess, prevent, and manage pain. B, both spontaneous awakening trials and spontaneous breathing trials. C, choice of analgesia and sedation. D, delirium, assess, prevent, and manage. E, early mobility and exercise. And F, family engagement and empowerment. And some authors even assess the possibility of including the letter G, referring to good sleep, that is the promotion of quality sleep in patients under intensive care. So we need to find a balance between patient comfort and safety, sleep preservation and circadian cycle, with pain control, adequate sedation, and early mobilization. Regarding pharmacological approaches, current recommendations are not to use them to prevent delirium. It's suggested to use only as a part of the treatment in patients with severe refractory delirium who do not respond to non pharmacological measures and who may be very agitated at risk of mutilating themselves or injuring someone in the team or family. When choosing an antipsychotic, attention should be paid to side effects. Therefore, an electrocardiogram and daily control of electrolytes and QTC interval are recommended. As in adults, we should always avoid the use of benzodiazepines. So thank you so much for your attention. Here are my contacts and good World Delirium Awareness Day.